Okay, hello everyone. My name is Priyanka Senthil and I'm a member of the American Lung Cancer Screening Initiative, or ALCSI as we like to call it. So today we will be giving a presentation on lung cancer and lung cancer screening, and we're really grateful for the opportunity to present to you today. So before I get into the content of the presentation, I'd like to share a little bit about what the American Lung Cancer Screening Initiative does. So ALCSI is a 501c3 nonprofit that works to raise awareness for lung cancer and lung cancer screening. And we're a team of over 50 passionate students and doctors located across the United States. So we've worked with community organizations like the South Asian Network and the American Indian Cancer Foundation, as well as city and state health departments, including the New York City and Connecticut health departments. And we hope that in educating communities about lung cancer and lung cancer screening, high-risk community members will be encouraged to seek lung cancer screening. So if you're interested in learning more about ALCSI, we'd like to invite you to visit our website at www.alcsi.org. And please feel free to email us with any questions. So today we'll discuss both lung cancer screening and lung cancer in general, addressing questions such as how common lung cancer is, what lung cancer screening is, and how you can get screened. So to start things off, lung cancer is very common. It is the second most common cancer in the US, excluding skin cancer. It is also the most fatal. So this graph shows the American Cancer Society estimates for the number of new cancer cases in the United States. And this graph estimates new cancer cases in 2020 for the 4 most common cancers. So as you can see, it was estimated that 228,820 people were diagnosed with lung cancer in 2020 in the US. So to put this number into perspective, it is estimated that about 6% of people will develop lung cancer during their lifetime in the United States. So that means 1 in every 15 men and 1 in every 17 women will be diagnosed with lung cancer. And moreover, not only is lung cancer very common, but it is also very fatal. It is, in fact, the leading cause of cancer-related death in the US and the world. And in 2020, it was estimated that lung cancer claimed the lives of 135,720 people. So this graph shows the American Cancer Society estimates for the number of cancer-related deaths in the United States. And as you can see, lung cancer is far more fatal than breast, prostate, and colon cancer. And it causes more deaths than all 3 of those combined. And every year, even though there are about 50,000 more new cases of breast cancer, lung cancer still causes over 90,000 more deaths. And just to emphasize this disparity, in women alone, every year lung cancer causes more deaths than breast cancer, ovarian cancer, and uterine cancer combined. So it really is a huge problem. And so if we look at lung cancer incidence and mortality by sex and race, you can see that among males, lung cancer incidence is highest among Black males at an incidence rate of about 71.7 per 100,000 people. And among females, lung cancer incidence is highest in white females at an incidence rate of 44.7. And mortality rates mirror incidence rates. So Black males have the highest mortality rate among males, while white females have the highest mortality rate among females. And from this data, the question that arises is, why is lung cancer mortality so high? Well, lung cancer mortality is so high because patients are typically diagnosed at a later stage. So this is a graph looking at the proportion of patients with lung cancer by stage. So stage is simply a way for doctors to classify a cancerous tumor based on tumor size, if the cancer is spread to lymph nodes, and if the cancer is spread to other locations in the patient's body. So currently, most lung cancers are diagnosed at a distant stage, when the cancer has spread beyond the site in the lung where it originated. And this graph is based off of data from 2008 to 2017, published by the National Cancer Institute. And as you can see, about 21% of patients are diagnosed at a localized stage, while the majority, 51% of patients, are diagnosed at a distant stage when the lung cancer is already spread to other locations in the body. So why is this important? Well, it's important because the stage that lung cancer is diagnosed at directly correlates with survival. And we'll see this in the next slide. So one way the doctors track the survival of patients is by looking at the 5-year survival. And as you can see, the 5-year survival for lung cancer at the early stages is high, as we would expect, but the 5-year survival significantly drops as the disease progresses. And this graph is just another way to understand the relationship between stage at diagnosis and 5-year survival. So 5-year survival for patients with localized lung cancer is 59%, but only 23% of the cancers are diagnosed at this stage. In comparison, nearly half of the lung cancers are diagnosed at a distant stage. And this is why lung cancer screening is so important, because with early detection of lung cancer, we can detect the lung cancer when it is at an early stage, when treatment options are better and prognosis is better. So with lung cancer being such a morbid disease, some of you might be wondering then, why is the majority of lung cancers diagnosed at a later stage? Well, the majority of patients are diagnosed at a later stage because they don't start feeling any of the symptoms of lung cancer until it has already grown and spread. So the most common symptoms of lung cancer are chronic cough, coughing up blood, chest pain, and shortness of breath. And additional symptoms may include hoarseness, loss of appetite, fatigue, persistent lower respiratory infections, and a new onset of wheezing. However, when patients finally do become symptomatic, the cancer has already grown and spread to a point where it is more difficult to treat and the prognosis is poor. So if the diagnosis of lung cancer has to wait until the patient has symptoms, then it's going to be difficult for us to catch lung cancer early. And then the question that we ask is, how do we catch lung cancer early if patients are asymptomatic? And this is where lung cancer screening comes into play. So lung cancer screening is done using something called a low-dose computed tomography scan. And if you're eligible for lung cancer screening, it is recommended that you get screened for lung cancer annually. And in the coming slides, we'll discuss what that process will look like for people. So an important distinction that we want to make is that lung cancer screening is done using low-dose computed tomography, also known as low-dose CT, and not the chest X-ray. So we use low-dose CT scans because they provide more detailed pictures than chest X-rays, and they're better at finding small abnormal areas in the lungs. So the picture on the left is a picture of a chest X-ray, and the yellow arrows point to the abnormal area in the lung, but as you can tell, it's a bit unclear. On the other hand, the image on the right is a picture of a low-dose CT scan of the chest, and the red arrows also point to the abnormal area in the lung. And as you can see, this image is more detailed than a chest X-ray, and it enables us to see the abnormal area in much greater detail. And so for a long time, the question that researchers wanted to answer is, how effective is low-dose CT scan at detecting lung cancer at an early stage? And an important lung cancer screening trial called the National Lung Cancer Screening Trial, or NLST, tried to answer this very question. So the NLST was a large national study with over 50,000 patients, and the goal of the study was to determine the effectiveness of using low-dose CT scan to detect lung cancer in patients considered high risk for lung cancer. So the study included two groups. One group of patients who received annual low-dose CT scans, and a group of patients who received an annual chest X-ray. So by comparing the stages at which cancers were caught between these two groups, the study was able to determine if low-dose CT scan was better at catching more lung cancers in an early stage. So as you can see, of everyone diagnosed with lung cancer, the low-dose CT scan caught the most lung cancers at an early stage, while the chest X-ray diagnosed patients at stage 4, which is the distant stage. And this has important implications for survival, because the low-dose CT scan caught more lung cancers at an early stage. These cancers were more likely to be treatable, and therefore the prognosis was probably much better for these patients. And in fact, this translates to a 20% reduction in mortality for those who underwent lung cancer screening using low-dose CT versus lung cancer screening via chest X-ray. So a concern that some people have with lung cancer screening via CT is its accuracy. So it's essentially, how good is low-dose CT scan at catching lung cancer? So for every 100 individuals undergoing CT lung screening, 75 of those 100 will be negative. And of those 75 that are negative, 97.7 to 100% truly do not have lung cancer. So this means that the test is very good at identifying people who do not have lung cancer. So that is, if you have lung cancer, then the test will most likely come back positive, and it will not miss your cancer. So as we move our attention to the 25 individuals that are positive, 23 turn out to be negative for lung cancer, primarily with fall imaging alone. So this means that even if your test result is a false positive, it's very easy to rule out cancer using further non-invasive imaging. And the 2 individuals that have a positive test result truly do not have lung cancer and are more likely to be diagnosed at an early, they truly do have lung cancer and are more likely to be diagnosed at an early stage than if they were not to undergo lung cancer screening. So this means that their treatment options are better and their prognosis is also better. And the results of the NLST were published in 2011, so 10 years ago, and several studies have been published since then, further confirming the life-saving benefit of lung cancer screening in high-risk populations. And one of these other trials is the Nelson trial. So in February of 2020, the results of the Nelson trial were published. And like the NLST, the Nelson trial had 2 groups, but instead of comparing individuals with CT and chest X-ray, the NLST compared groups who received CT screening and no screening of any kind. So a total of 13,195 men and 2,594 women between the ages of 50 and 74 were randomly assigned to undergo CT screening at T0, which is baseline, year 1, year 3, and year 5.5, or no screening if they were in that control group. So the results confirm the life-saving benefit of lung cancer screening by low-dose CT, because in the screening group, 58.6% of lung cancers were diagnosed at stage 1, while in the non-screening group, 13.5% of lung cancers were diagnosed at stage 1. So a much higher percentage of lung cancers were diagnosed in an earlier stage in the group that underwent CT screening. And as we talked about before, early detection translates to a reduction in mortality. And in the low-dose CT group, there was a 24% reduction in lung cancer mortality in men and a 33% reduction in lung cancer mortality in women when compared to no screening. So that's huge. And the Nelson trial also showed that with improvements in low-dose CT technology, the false positive rate that we talked about in the previous slide can be reduced significantly. So lung cancer screening significantly reduces lung cancer mortality. But who should get screened for lung cancer? Well, the United States Preventative Services Task Force, also known as the USPSTF, sets guidelines for who should get screened for lung cancer. And right now, they recommend that people between the ages of 50 and 80 who have a 20-pack-year smoking history or greater and are current or former smokers who quit within the past 15 years get annual low-dose CT scans. So I know this is a lot of information, but the current screening guidelines require you to have a 20-pack-year smoking history, which is one of the most important parts of it. So pack year might not be a term that many of you have heard, but it's just a way for doctors to track your smoking history over a period of time. And a pack year is defined as smoking 1 pack of cigarettes a day for a year. So for example, if you were to smoke 1 pack a day for 20 years, then that would equate to a 20-pack-year smoking history. But you could also reach a 20-pack-year smoking history by smoking 2 packs a day for 10 years. And that would also be a 20-pack-year smoking history. So the important takeaway here is that there are many different ways to reach a 20-pack-year smoking history, and the pack year is just a way for doctors to keep track of your smoking history. And then one thing that I'd also like to point out is that the USPSTF guidelines were recently updated. So the USPSTF had slightly different guidelines about 5 months ago and updated their screening guidelines this year. So the previous screening guidelines only recommended that individuals between the ages of 55 and 80 with a 30-pack-year smoking history get screened. But as you guys saw on the last slide, the new guidelines now lower the age bound to 50 from 55 years old, and the pack year smoking history is also lowered from 30 pack years to 20 pack years. So we're really excited about these new guidelines because they will nearly double the number of eligible patients for lung cancer screening in the United States. And most notably, the most apparent increases in eligibility will occur among women and minorities. So we're definitely making some advances there. And however, while these new guidelines will include more high-risk individuals, they only include individuals with a heavy smoking history, because you need to have that 20-pack year smoking history, as we saw. However, the problem here is that there are other risk factors for lung cancer screening that are not accounted for in the current screening guidelines. So, for example, additional risk factors for lung cancer screening include things like exposure to secondhand smoke, exposure to radon, exposure to asbestos, a family history of lung cancer, COPD, and previous radiation therapy to the lungs. So because these are all risk factors for lung cancer, it is important that we recognize these additional risk factors and find a way to identify patients who need to get screened for lung cancer, even if they're not smokers. And many people think that lung cancer only happens in smokers, but really there are a large number of people in the United States who have never smoked but still get lung cancer. And never smokers are defined as individuals who have smoked less than 100 cigarettes in their lifetime. And because lung cancer has such a strong association with smoking, people are often surprised to learn that lung cancer never smokers accounts for 10 to 20% of lung cancer diagnoses. And deaths in never smokers due to lung cancer is the 7th leading cause of cancer-related death in the US and the world. So just to put this into perspective, more never smokers die from lung cancer each year than people die from ovarian cancer. So it really is a huge problem. And this graph shows the proportion of lung cancer cases that occur in people who have smoked in their life, as well as people who have never smoked. And then it is then further broken down by whether they're a current, former, or never smoker. So as you can see, 80 to 90% of lung cancers that occur in people who have smoked during their lifetime, and about 10 to 20% occur in never smokers. And interestingly, women are more likely to be never smokers when diagnosed with lung cancer. And in fact, in the United States, 60 to 70% of never smokers are women. So right now, lung cancer screening is not recommended for individuals who have never smoked, but understanding lung cancer in never smokers is a current focus of research. And with the development of new screening technologies and risk models, there may be a way to identify high-risk never smokers who should be screened for lung cancer. So in summary, lung cancer is a leading cause of cancer-related death in the US. And it is so deadly because lung cancers are diagnosed at a later stage when they've already spread to other locations in the body. And importantly, early detection through lung cancer screening by the use of Lowdose CT can reduce lung cancer mortality by up to 33%, as we saw in the Nelson trial. However, the problem now is that only 5.7% of high-risk individuals are currently getting screened for lung cancer. And to highlight how low this number really is, here we compare the lung cancer screening rate to the screening rates for breast, cervical, and colon cancer. So all 4 of these cancers have screening tests that are recommended by the USPSF. But right now, only 5.7% of high-risk individuals are getting screened for lung cancer. This rate is extremely low in comparison to the screening rates for breast, cervical, and colon cancer. And the American Lung Association estimates that if we were to screen every high-risk individual recommended by the USPSF, in the US alone, we could save 48,000 lives. However, because we were only screening 5.7%, a lot of lives that could be saved are currently not being saved. And the main reasons for that is because patients have concerns about about this cost of screening and the access to screening and the safety of screening. And all of these misconceptions about lung cancer screening are due to the limited awareness and education about lung cancer and lung cancer screening. So in the next slides, we will discuss each of these topics, but the important takeaway right now is that though lung cancer screening can help reduce an individual's risk of dying from lung cancer, people are currently not being screened for these reasons that we'll talk about in the next few slides. So the first potential concern that we will address is the cost of lung cancer screening. So the average low-dose CT scan costs anywhere from $300 to $400, but most insurance companies, including Medicare and Medicaid, will cover the cost for eligible patients. However, there are a few exceptions that I'd like to make note of. So one, Medicare will only cover lung cancer screening until the age of 77. Two, not all state Medicaid plans cover lung cancer screening. And three, patients will still pay the usual fees for provider appointments before or after the scan. And as I just mentioned, unfortunately, not all state Medicaid plans cover lung cancer screening. So here is a map updated in July of 2020, showing which state Medicaid plans do and do not cover lung cancer screening. So the blue states have state Medicaid plans that cover lung cancer screening, and the purple states do not. And the pink states are ones in which we don't really know this information. So the first step to getting a patient screened for lung cancer is having them talk to their primary care provider. So there are certain questions that a primary care provider has to ask and topics that need to be discussed before a patient should get screened for lung cancer. And one of these, like we've talked about before, is the patient's past smoking history, because it's crucial in determining when and whether a patient should get screened. And so to find accredited lung cancer screening centers, patients can go to the American College of Radiology website, where they can type in the state or city that they live in and see the accredited lung cancer screening facilities located near them. And the American College of Radiology website is listed on the bottom left-hand side of the screen. So this is a map of accredited lung cancer screening facilities in Massachusetts. And as you can see, each red pin represents an accredited screening center, so it's very easy for patients to find one if they're interested. And as far as how the experience of getting a low-dose CT scan goes, it will require you to lay on your back for about 5 minutes, and you'll be doing something very similar to the person in the photo. And one thing to note is that this process does not hurt at all, because it's a low-dose CT scan, so we're not using contrast or needles. And this means that there will not be any injections involved, like I just said. And the low-dose CT scan is also non-invasive, fast, and the radiation exposure due to CT screening is very low. So a way the doctors measure the amount of radiation a patient may receive is through a unit called the millisievert. And it's just a way to measure radiation and compare the levels of radiation received during different activities and over time. So for a low-dose CT scan, you will be exposed to 1.5 to 2 millisieverts of radiation. And this is a lot lower than the full chest X-ray, which requires a radiation dose of 8 millisieverts, which is almost 4 times more. So to put that into perspective, you are exposed to 3.11 millisieverts of radiation a year just from breathing, cosmic radiation, eating, and radiation from the earth. So getting a low-dose CT scan exposes you to less radiation than you're exposed to from just existing on Earth, which means like this level of radiation that you receive is very small. That being said, if this is a concern for patients, it's always something that they can discuss with their primary care provider. Okay, so now going back to the steps of lung cancer screening, a patient talks with their primary care doctor. So what is the next step? Well, the PCP will likely refer the patient to a screening center if they are eligible for lung cancer screening, and they will receive their low-dose CT scan. And then after that, the doctor will receive the results of the patient's screening test and will follow up with the patient to go over the results. And as far as results go, there are 3 most likely outcomes. The first outcome is that the scans are normal. And if that is the case, then the patient should look to get repeat scans in a year. And if the scans are abnormal but benign, then the patient should talk to their doctor about the next steps. And these next steps may include scans, tests, or biopsies to further confirm whether it is lung cancer, and if so, what stage lung cancer is in. And then if the scans are abnormal and suspicious, then the patient will most likely have to undergo additional testing, such as a biopsy. Okay, so lung cancer screening saves lives, but a question that we get now is that can individuals still get screened for lung cancer during the COVID-19 pandemic, and is it safe to do so? So during the pandemic, the number of cancer screenings has decreased significantly, but lung cancer won't stop because of the pandemic. So if a patient is at high risk for developing lung cancer, it is important that they get their annual lung cancer screening test. And right now, most hospitals have operating lung cancer screening programs, and patients can wear a mask during the entire screening process. So as long as patients follow the necessary precautions, like wearing a mask, then lung cancer screening during the pandemic is fully safe. And the pandemic should not deter patients from getting screened for lung cancer. And another question that we often get is how vaping and e-cigarette use affect lung cancer risk. So vaping and e-cigarettes are relatively new phenomena and have become more prevalent in the last decade. And while the long-term effects of vaping and e-cigarettes are still being studied, it is clear that for individuals who have never smoked before, they can increase their risk of lung cancer. So e-cigarette devices and vaping fluids contain nicotine derivatives and heavy metals, among other chemicals. And these arise both as elements of the e-cigarette liquid, as well as organic reactions within the electronic cigarette device itself. So various studies demonstrate that in vitro transforming and cytotoxic activity of these derivatives can increase risk of lung cancer. And though vaping does cause relatively fewer risks than smoking, it is still not a risk-free activity, and that is a misconception that many people have. Vaping can increase heart rate, decrease air volume in the lungs, and increase airway resistance, all of which can affect health. And furthermore, e-cigarette devices have been significantly increasing. Their use has significantly been increasing. So, and particularly among young adults and non-smokers. So this is definitely a concern for the future and an area of significant research as well. And additionally, while lung cancer screening has the potential to save many lives, it is important to address that smoking cessation in the context of lung cancer screening. So lung cancer screening is by no means a substitute for smoking cessation, and likewise, smoking cessation is not a substitute for lung cancer screening. So smoking cessation is one of the best ways to prevent lung cancer, and lung cancer screening is one of the best ways to detect lung cancer. So using both is going to be the best way to fight the disease. And for every year after an individual quits smoking, their risk for lung cancer is reduced by 8% to 17%, depending on the kind of lung cancer they have. So smoking cessation really does have a huge effect on a person's likelihood of developing lung cancer. And another reason that smoking cessation is important is because it is required by Medicare and Medicaid services in order to be covered for things like lung cancer screening programs. And another important thing to note is that we do understand the lung cancer, that smoking cessation with regards to lung cancer screening can be difficult. There are a lot of resources though for people trying to quit smoking, and some great programs near UNR itself are the renowned Health and Wellness Quit Smoking Program and the Nevada Cancer Coalition's Quit Smoking Program. All right, so as this presentation comes to a conclusion, we just want to end on what we, the American Lung Cancer Screening Initiative, are doing to begin the widespread awareness, education, and advocacy efforts necessary to increase the lung cancer screening rate and save lives. So though lung cancer is the deadliest cancer in the world, and lung cancer screening can save many lives, but what we need to target are the high-risk individuals who are currently not being screened. And so our organization works to address all aspects of these issues. So we wrote and advocated for House and Senate resolutions expressing support for a Lung Cancer Awareness Month and early detection through lung cancer screening. And last December, our Senate resolution was passed by unanimous consent. Additionally, we are working to teach communities across the country about lung cancer and lung cancer screening. And as we're doing with this presentation, we've been collaborated and partnered with different middle schools, high schools, universities, and other STEM organizations to reach the younger population as well, to start this conversation about lung cancer and raise awareness about things like vaping and e-cigarette use and how they can contribute to lung cancer risk in the future. So though lung cancer is the deadliest cancer in the world, the first step to combating lung cancer is really working together and working with our own local communities to start raising awareness. And we believe that by educating communities, and especially the students and younger generations, we can lower the number of deaths associated with the disease, because students greatly impact and influence the healthcare of their parents and grandparents. So by educating students, we can also help the later generations as well. So we are so grateful to have had the opportunity to present to you today, and thank you all for your time. And we hope that you're able to leave this presentation with a better understanding of lung cancer and lung cancer screening. And that being said, there are tools that we can and actions that we can take to help reduce lung cancer and lung cancer and mortality associated with lung cancer. And so the American Lung Cancer Screening Initiative is always looking to help raise awareness for lung cancer, and we host a variety of events related to lung cancer screening, and we share our upcoming presentations and webinars on our website, as well as other resources and handouts if you know someone who might be eligible for lung cancer screening. So if you have any questions, please feel free to send us an email and visit our website if you are interested. And additionally, if you're interested in helping raise awareness for lung cancer screening in your own local community, then we would love to work together to accomplish that. So thank you guys for listening. And at this time, I will open the floor for any questions.
Okay, does anybody have questions? I always had like a question, and then the next slide you answered it. So you were very thorough with everything, which is amazing because I'm never that thorough. Did you know that lung cancer screenings, there's like certain clinics for it? It doesn't really happen it's not really available in everyone's like local hospital?
Right. So certain hospitals have the technology needed for lung cancer for CT screening. So as you guys saw in the previous slides, the machine needed for CT screening is pretty large and very expensive as well. So not all hospitals, and definitely not all clinics, will have this technology available for patients, but a lot of large hospitals that are geared towards either like cancer treatment or just larger hospitals like Massachusetts General Hospital, for example, will have these technologies. And so people can always visit the radiology website that was on the previous slide to find the facilities that have the CT screening machinery for them.
Oh, okay. That was really much the questions I had. Yeah, I wrote a bunch down, but every next slide you answered them completely, and I was like, oh, I don't even have a question at the end. Does anybody else have questions? I'll open the floor up to everyone else. But like I said, you were very thorough. Well, if nobody else has any questions, we can end the meeting here then. Priyanka, again, thank you so much for giving us a talk. It was very insightful. And for everyone else who doesn't know, Lung Cancer Awareness Month is next month in November. So this information is very beneficial to know. But yeah, if nobody else has questions, we can end the meeting here. Thank you again, Priyanka, for rescheduling and on such a short notice. I know it's Halloween weekend, so.
Yeah, of course. Thank you guys for having me. It was a pleasure talking with you guys.
Oh yeah, thank you so much. Yeah, have a good night, everyone. Thank you.